Okay, now we're going to go over precocious puberty. I could be saying that completely wrong. Oh well. So basically what it is, it's early puberty. So usually puberty happens for females between 10 to 12 years old and for males 11 to 14 years old. But in precocious puberty, for the female, which is more common for this, it'll happen before they're 8, and for males it'll happen before they're 9. So the pathophysiology behind it is it's premature activation of the hypothalamic pituitary gonadal axis. Basically, this results in production of GnRH, which produces LH and FSH, which stimulates gonads to release estrogen or testosterone. Basically, it's just premature activation of this certain part of the pituitary gland in the hypothalamus, and it'll stimulate estrogen or testosterone. But because it's premature, that's the whole reason why everything's happening early. So, some causes of that. For females, it's not really known. But for males, they say that it could be like a centroneural abnormality or tumor. And then for signs and symptoms, it'll be acne or adult-like body odor. Because remember, these are children. An accelerated rate of growth. So it's kind of the opposite of the last one that we looked at. They'll develop breast, pubic hair, and they'll have an increased maturation in genitalia. Sometimes they'll be aggressive and they'll have mood swings because they're going through puberty early. So these are all signs of puberty. So some lab and diagnostic testing. So you can do a pelvic ultrasound to see if they have advanced bone age. And then it'll also show you the increased uterus size and ovary development, which again is too early. Or you could do the radioimmuno, whatever the heck, to test for the LH, FSH, and estradiol and testosterone. So if those are increased, they could have it. And then the GnRH stimulation test. So what happens is you're going to administer a synthetic GnRH through the IV, and you're going to draw some blood tests, and you're going to check blood levels every 2 hours for the estradiol. I don't know if I'm saying that right, whatever. So for this to be positive, then it'll have pubertal or adult levels of these things. It doesn't go into specifics about what the levels are, just if the levels are at adult level for the LH, FSH, and estradiol or testosterone, then it could be precocious puberty. So treatment. You want to give them a GnRH analog, so it's a subcutaneous injection daily. Or you could do the intranasal version, which is 2 to 3 times daily. Or you could do a depot injection, which is every 3 to 4 weeks. Or you could do it quarterly as well. And then the subcutaneous injection is daily, but then you also have the subcutaneous implant. That's yearly. So what this is supposed to do is it's going to slow down the growth rate, and it'll slow down the secondary sexual characteristics, the development. It'll slow it down, or sometimes it'll even reverse it. That's the goal. And then there's specific one, which is medroxyprogesterone injection or tablets. Those will decrease secretion of gonadotropins and prevent menstruation because they're literally before the age of 8. So they could be 5, 6 years old. You don't want them to have to go through that. So it'll reverse it or it'll stop it from happening. And then whenever the treatment is discontinued, puberty will resume where it kicked off. So it's not going to stop their things from never having puberty. It just stops it for them now. And then the management that you want for it, you want to provide education to the family. So you want to encourage families to comply with follow-ups every 6 months. Basically, whenever you're doing that, you're checking the levels every time to make sure that they're staying within their age range. You want to tell the family that treatment stops when the child is old enough for puberty. So when they're old enough to start having all of these things, then you can stop the treatment so you can start having puberty. And you want to provide sex ed to the family and to the child, because if a child is having all of these, essentially their body is becoming ready to be able to grow a child, but obviously they're not physically ready. So you want to provide sex ed because it can still happen. So support emotional needs and self-esteem. They're going to have self-esteem issues because of their body image. They're going through puberty and no one else looks like them. So you want to help the child understand what's happened physically and emotionally during puberty. Because physically they're changing, emotionally they're going to be a little bit more moody, aggressive. And then you do want to tell them something is that everyone develops sexual characteristics in their own time. So developing the sexual characteristics isn't abnormal. So you do want to make them know that it's okay to grow and develop these things, but it's just not at the right time. But everyone will eventually develop those characteristics within time. So that's the main thing there.